sport. I love it because it brings me tears. Tears of victory, tears of joy. The skill that leads to the pass that leads to the shot that leads to the goal that determines the ultimate. Channel Sports, defining the moment of true sport.
Welcome back, and remember, all our top stories and other programs are on our website. It's channelstv.com and on youtube.com/channelsweb. If you're on the go, then visit m.channelstv.com to view us live on an iPad, an iPhone, or a BlackBerry. You can also download the Channels TV app for Android and Nokia 920 devices from their respective stores. The plight to students whose academic programs have been disrupted owing to the current strike action by university lecturers should be enough to motivate the end of the action and focus on improving the standards of education in the country. That's according to the Minister of Labour and Productivity, Mr. Emeka Wogu. He insisted that the government has shown enough commitment to address the issues once and for all.
Personally, as Minister of Labour and Productivity, I'm urging ASUU to reconsider their position on the strike and resume so that people who are at the verge of taking their terminal exams will be given the opportunity to do their exams. And I'm talking about the Nigerian children who are students in all the tertiary institutions affected by this strike. We can actually equally discuss, even if the school was in, the session was on. We could still discuss. We don't need to, but all the same, there's a strike. We are working towards, reaching, further understanding with ASUU so that they can call it off. But I appeal, on behalf of the federal government to ASUU to call off their strike. And I equally appeal to them. I'm a father, I'm a parent. I have guardians. I have people, who I pay their school fees in the universities. The more they stay, everybody is being affected by this particular strike.
Minister of Labour and Productivity, Mr. Emeka Wogu. Well, I might have to also extend that appeal to health sector workers who are also downing their tools in federal hospitals. Now, as more state chapters of the Joint Health Union join their counterparts to press home their demands for improved welfare, our correspondent Kelvin Obeton looks at the situation in some states and reports.
In Kaduna State, due to the absence of health workers, there were skeletal services at both the Federal Neuropsychiatric Hospital and the National Ear Care Center. Senior officials of Health Workers Union in the state explained that workers will not resume until the federal government meets their demands.
We have issues that are so genuine that are affecting our welfare. For example, a staff that's supposed to be promoted from 9 to 11, that is keeping of Congress 10. The minister refused that it should not be done. And it's applicable to all ministries. We don't know why only in the Ministry of Health that these problems are happening.
Activities at the Jos University Teaching Hospital, North Central Nigeria, is at the lowest ebb due to the ongoing industrial action by members of the medical and health workers under the auspices of joint health sector unions.
Strike is total, as you can see. We are proceeding with the strike.
The management of the hospital is striving to ensure that skeletal services are provided, especially in emergency cases.
To ensure that at least we have the skeletal services in the emergency areas.
Back in Lagos, the strike has been effective. The National Orthopedic Hospital in Gobi was bereft of health workers, although security personnel did not allow the use of cameras. It was glaring that something was imminent. Most of the patients who had appointments could not be attended to.
When we came, they said they are on strike, that they cannot attend to us, that they don't know when they will call off the strike. So that's why we are going.
I said that there is strike. There was strike.
So did they ask you to come back for any further medical treatment or special one?
They said I should come back for they said I should come back, but they have not examined the day after strike.
Following the expiration of a 21-day ultimatum given to the government to resolve issues pertaining to the welfare of its members and other professional allowances. Kelvin Obetin, Channels Television News.
Well, as that strike action bites further into major hospitals across the country, patients are the ones left to bear the brunt. And our focus on health, our correspondent Yomi Otaibe takes a look at the thorny issues that have left the patients at the receiving end of the tussle between the health workers and the Federal Ministry of Health.
Most times when strike is mentioned in the health sector, a lot of minds race towards the doctors. But the present strike is not their call. Rather, health professionals under the umbrella of the joint health sector unions, comprising nurses and midwives, pharmacists, medical and health workers, medical lab scientists, Senior Staff Association of Universities Teaching Hospitals, and Non-Academic Staff Union of Educational and Associated Institutions are the ones with grievances and demands as varied as their members.
The medical practitioners in Nigeria have seemingly hijacked the position of the Chief Medical Director for themselves only. All our colleagues who apply for this position, they have used their position to misinterpret the provision of the law. Whereas the law says the post should be open to all healthcare professionals with competence and managerial expertise.
The Federal Ministry of Health has since 2012 directed hospitals under her supervision to promote members in line with approved scheme of service. And this has been ignored by various managements of teaching hospitals.
The report on harmony shared by Justice Abdullahi Bello, submitted since 2011. It may interest you to know that there are some other reports that were submitted much later, and it has pleases the Federal Minister of Health to implement these reports.
Sincerity and equality at the Federal Ministry of Health were also called to question.
The government, through the Ministry of Labour, invited all parties to a roundtable discussion, and all agencies of government were in attendance, including the Salaries and Wages Commission, and the Federal Ministry of Health was led by the Permanent Secretary and all other high-ranking officers. They reiterated their commitment to implement those issues within a specified period. I think they gave us 2 weeks? 6 weeks to implement all those items that are outstanding. We know for sure that they are used to this type of practice because the 10th May agreement of 2012 is yet to be implemented to date.
In view of all that has been said, and in view of all the actions and inaction of our Minister of Health, Professor Chukwu, we are calling on Mr. President to please remove him immediately as Minister of Health.
For the man in the eye of the storm, the Minister of Health, Professor Onyebuchi Chukwu, the government has tried to resolve some of these issues, but agreements on the demands for the skipping of consolidated health salary structure, CONHES 10, payment of specialist allowance, issues of consultancy status for allied health professionals, and core duty allowance have been difficult.
I protect the interests of every health worker, provided that interest must be genuine, must be legitimate, it must fall within the extant policies and laws of the Federal Republic of Nigeria. It must be in the interest of Nigerians, particularly the patient. We have been discussing with them. Mind you, at a stage, we said the areas, these 4 core ones, which they said we have been discussing for years. And mind you, many of them were before I became a minister. So it's not something that is peculiar to me. It's something that started way before I became a minister, but I've solved quite a number of them. So we had always been talking with them. And when those 4 issues, it was apparent that we are at, opposite posts, as it were, The Minister of Labour and Productivity